SCRUB program really came from Germanna's Nursing and Allied Health Advisory Committee, which is composed of the CEOs and the vice presidents of nursing in the region's hospitals. And it's been several years that the members of the advisory committee came to us and said, we have a desperate shortage of surgical scrub nurses. And at that time, Mary Washington was in the process of building, expanding. They grew 4 more ORs, I believe. And of course, Stafford Hospital was on the drawing board at that time. So Germanna was fortunate enough to have Jennifer Corwin, who is a seasoned, experienced surgical nurse who's enthusiastic and willing to take on starting up a new program. And Jennifer started it, and we had our first student a year ago, and I'll let you take it from there.
We started with 2 students, actually, and we went to our 4 clinical sites. We had our lectures here at DCAT. We have our simulated instruments that we practice with, and our clinical sites are Culpeper Regional Hospital, Culpeper Outpatient Surgery Center, Mary Washington Main OR, Fredericksburg Ambulatory Surgery Center, and Surgery Center of Central Virginia is new to us this year. The students go to clinical 2 days a week for 2 8-hour days, so that's 16 clinical hours. They work with a preceptor, and they have, by the end of the course, they will have all done at least one surgery all by themselves. And they will be ready for employment. This particular group is a 16-week course, and we will be ready to graduate the middle of March. So the ORs can look forward to having we have 1 absent today, 6 new scrub nurses that have a general surgical background experience.
Each one of these students are licensed practical nurses, so they've already been through a program of study that prepared them to become licensed nurses. And we are real excited. We run the program once a year. We're looking forward to working with HCA Virginia's Spotsylvania Regional Medical Center, and hopefully that as soon as that hospital is up, we'll be having students in that operating room area as well. So,
Culpeper's expanding.
Culpeper, you want to tell them about Culpeper?
Yes. Culpeper is also thinking about expanding since their recent merge with University of Virginia Health Systems, and they have in their operating room now, they do a lot of patients in a 2-room operating room. So I know they are anxious to expand, and also with their expansion they're going to need more scrub nurses in those roles. And their outpatient surgery center is also getting very busy in Culpeper as well as the region expands, and they have a large need for scrub nurses in that area. The nursing shortage has impacted the OR greatly. A lot of the OR nurses are of the same age group, it seems, demographically. So they are very panicked about our nursing shortage come 2010, when demographically a lot of the nurses my age will be retiring. And so they are anxiously awaiting our new graduates for employment into their health system.
And really, that advisory committee had the foresight to realize that the shortage was upon us, yet our numbers of OR rooms were going to be increasing. And so we were glad that Germanna Community College was able to respond to the community's need by establishing this course. And again, it is central to its success is having this experienced, wonderful teacher, Jennifer Corwin.